1, 2, 3, 4, 1, 2, 3, 4. 1, 2, 3, 4. 4, 5, 6, 7. Раз, два, три. 1, 2, 3, 4, 5, 6, 7. 1, 2, 3, 4, 5, 6, 7, 8. 5, 6, 7, 8, 9. 5, 6. 5, 6, 7, 8, 9. 5, 6. 1, 2, 3, 4, 5. 5, 6, 7, 8, 9. 1, 2, 1, 2, 4, 5, 6. 1, 2, 1, 2, 4, 5, 6. 5, 6, 5, 6, 5, 6, 5, 6. 3, 4. 3, 4, 3, 4.
Раз. Раз, 1, 2, 3, 1, 2, 3, 4, 5. Раз, раз, 2, 3. 1, 2, 1, 2, 1, 2, 3. 1, 2, 3, 4, 5. 6, 7, 8. Раз, 1, 2, 1, 2, 3, 4, 5. 6, 7, 8, 9, 11, 12. 1, 2, 1, 2, 3. 1, 2, 3, 4, 5. Раз. 1, 2, 1, 2, 3. 1, 2, 3, 4, 5. 6, 7, 8, 9, 10, 11, 12. Болды. Раз.
Ханс.
Добрый день, уважаемые коллеги. Сегодня у нас особенный день, когда наши почетные профессора имеют возможность пообщаться с нашим коллективом, с нашими студентами. И сегодня для меня большая честь от имени всего коллектива Казанского национального медицинского университета поприветствовать регионального директора Европейского бюро Всемирной организации здравоохранения доктора Ханса Клюге в стенах КазНМУ. Доктор Ханс Клюге находится в Казахстане с официальным визитом. У него трехдневная большая миссия. И сегодня это второй день его пребывания в нашей стране. Буквально вчера доктор Ханс и его коллеги совместно с Министерством здравоохранения провели большую работу. Были проведены встречи на самом высоком уровне, в частности, встречи на уровне парламента, заместителя председателя парламента, с нашим премьер-министром, господином Смаилом Алихановичем. И проведены большие встречи с медицинской общественностью на базе медицинского университета Астана. К слову сказать, вчера был проведен в Астане очень большое мероприятие, уже ставшее хорошей традицией, которое называется Walk the Talk, в котором приняли участие, я не побоюсь сказать этого слова, рекордное количество участников, более 1200 человек. Буквально на прошлой неделе казахстанская делегация посетила Израиль, Тель-Авив, где был проведен 72-й региональный комитет Европейского бюро ВОЗ. На данном мероприятии обсуждался широкий спектр вопросов, касающихся будущего развития нашего здравоохранения. Доктор Ханс, наш почетный профессор, региональный директор, своей приветственной речи всем участникам конференции рассказал дальнейшие направления развития, а также основные моменты новой так называемой реальности, в которой мы сейчас находимся. Dear Dr. Hans, it is a great honor for us today to have a personal contact with the staff and the students of the Kazakh National Medical University. And we are very pleased and thankful for all the efforts you are doing. And we know that each of the 53 member states has its own place in your heart. But having you as a regional director in Kazakhstan, second time in a year, actually highlights how Kazakhstan is important to you. And I would like to also announce that the already Kazakh delegation, Madam Minister Ajar Gineyat, announced during the 72nd session of the regional committee that Kazakhstan is proposing to conduct the 73rd session of the regional committee here in Kazakhstan. Уважаемые дамы и господа, на региональном комитете было госпожой министром Ажар Гинеят объявлено о том, что Казахстан приглашает все страны Евровоз провести следующий 73-й региональный комитет в Казахстане, в городе Астана. Это будет посвящено 5-летию принятия Астанинской декларации 2018 года. Также это будет посвящено 45-летию принятия важнейшей хартии здоровья, декларации по ПМСП в городе Алматы, Алматинской декларации, а также 75-летию Всемирной организации здравоохранения. На этом, уважаемые коллеги, нам предстоит большая подготовительная работа. Я уверен, что вместе мы с вами сделаем это мероприятие очень значимым и важным для того, чтобы подтвердить все те результаты, которые были приняты по тем результатам наших деклараций. На этом, пожалуйста, прошу, коллеги, сейчас хочу предоставить слово нашему уважаемому доктору Хансу Клюге со своей приветственной речью. Спасибо большое.
Dear Dr. Sharanov, for me to be at my university as honorary professor, thank you, спасибо, been given the honor for honorary professor in different places, but the first one you never. Rahmat. So Professor Sharanov kindly asked me to give a presentation. Maybe. Luce, da. So I wanted to give a presentation in 3 parts, basically under the theme, the new normal, because now we are getting out of the COVID-19 and we're living in the new normal. And the new normal I define as dual track. Dual track means that all countries in the world should be able to maintain constant readiness and alert to emergencies, but without breaking routine disease prevention and control. Because this is what we saw during the COVID-19, that the routine disease prevention and control stopped with a lot of health problems now. So I have 3 parts in mind. The first one is to tell something about the current emergencies. The second one, where is our region on the trajectory towards the Sustainable Development Goals, remember the SDGs, to be reached by 2030. And third part, what do we see as the future priorities? And I presented this to the 53 Ministers of Health last week in Tel Aviv, as Professor Sharanov was telling, and we had Dr. Azar Ginyat with us, very, very active in the name of Kazakhstan, and Professor Sharanov was the Deputy Executive President, and thank you very much, Rahmet, Professor Sharanov, for doing an outstanding job. When I became the region director 2.5 years ago, this region was almost crisis-free. Today, the region hosts 4 crises of global repercussions. Number 1, a devastating war in Ukraine, which unfortunately shows no signs of de-escalation. And I'm very concerned. Actually, the week of 10 October, I will go back to Ukraine for the 4th time this year, together with my good friend, the Minister of Health of Ukraine, Dr. Viktor Lashko, and we go close to the front line, and to see how we can help Ukraine prepare for the winter. We are very concerned with the winter coming, frostbite, lack of generators in the hospitals, and I want to thank Professor Sharanov, your country, your president, the leadership, for playing a very pacifying role. And I want to thank the people of Kazakhstan for welcoming so many people from other countries and from Ukraine, and to include them in universal health coverage. The first crisis. The second crisis, COVID-19. COVID-19 is still with us. Situation is better, but we anticipate some wave in fall or the winter. The single most important measure to be implemented for COVID-19 is to strengthen surveillance so that every country in the world is able to detect, if need be, a new emerging variant and implement some measures. Number one. Number two is to get the second booster shot, especially for the vulnerable people, the elderly people, the healthcare workers. And I want to congratulate the Minister of Health of Kazakhstan. Dr. Ginyat was telling me how advanced you are in this country with the second booster. Is not like this in many Western countries. And the third one, to take good advantage of the antivirals for high-risk groups, which can keep the people off the ventilator. So I think if we stand together and we fight fake news, that it should be possible to get through the winter without too much painful measures. The third crisis is the outbreak of monkeypox. We still don't know why this monkeypox all of a sudden appeared in the European region, while it is endemic in Central and Western Africa. The best way to prevent people getting infected from monkeypox and to keep everyone safe is, number one, to empower entrusted messengers to the community. That we have people talking to the high-risk groups with the right information, and to focus the few vaccines and treatment we have for the high-risk groups. I was discussing the monkeypox with Dr. Anthony Fauci the first week of August when I was in Washington, and you are thinking about the early days of transmission of HIV/AIDS and what it means for the monkeypox. And there are some parallels. The first one is that the biggest threat is stigma and discrimination. We should not stigmatize the high-risk groups. Men having sex with men, sex workers, transgender, and their sexual partners. We should have the open mind, because otherwise what will happen, people will not go to the healthcare services and hide and spread the disease. Fourth crisis, the last 2 years we have seen an increasing number of outbreaks of vaccine-derived poliomyelitis. And what we see is that the polio in New York is genetically linked with polio cases in Jerusalem, London, Western Ukraine, who are linked to polio in Afghanistan and Pakistan. What does it mean? My friends, it means that a crisis anywhere soon becomes a crisis everywhere. So we need multilateralism. We need partnership. No country can fight these emergencies alone. And when I met the Prime Minister yesterday, I asked Prime Minister to convey my appreciation to your President Tokayev, who was giving a great speech at the United Nations General Assembly this week, because he is promoting multilateralism, collaboration between the countries. This is very important. Now the countries are having negotiations on a new international legally binding instrument, kind of a pandemic treaty, which would mandate WHO to do faster reporting and responsibilize the countries to share transparently data. There is some fake news there, as if WHO would take over responsibility of the countries. Of course, this is not true. WHO does not work with prikazi. We give normative guidance, but it's important that we have an international treaty framework. So this is about the crisis. I believe that in these times of crisis, of a war in our region, it is more important than ever to be loyal to the European values of solidarity, of equity, of universality. And that is the core of my vision, to leave no one behind. We can leave no one behind. Number one. Second part, where are we on our trajectory towards the Sustainable Development Goals? Because now we have to move beyond the COVID-19. Let me give two examples. The first example is on non-communicable diseases, chronic diseases. we made an estimate that during COVID-19 times, 5 times more people died from cardiovascular disease than from COVID-19. The real pandemic is the cardiovascular disease. And there are 3 main drivers that are killing our people in the region that we can prevent. Number 1, tobacco. I was congratulating Mr. Prime Minister and the Minister of Health, Dr. Guignat, yesterday. It's amazing that your president signed increase of taxes to tobacco and also for heated tobacco products. And actually, Prime Minister was telling yesterday to move towards forbidding vaping. Because vaping, you know, this vaping for children is very dangerous. There is a lot of pressure from the tobacco industry. But your country moved forward, and I also thank the Vice Speaker of Senate and Vice Speaker of Majlis. Congratulations. I am using example of Kazakhstan here for the rest of the world. Second, preventable risk factor for strokes and heart attacks. The only thing which kills more people than tobacco is hypertension. I was telling the 53 Minister of Health, and Dr. Sharanov was there last week, honestly, we are doing quite a terrible job on preventing and managing hypertension. The most important measure to prevent hypertension is to reduce sodium in processed and packaged foods. Because the salt that we add to our food at the dinner table only amounts to about 10% of our intake. But you have it everywhere, from breakfast cereals to cheese to bread. We need the political will to regulate the industry. But even if we prevent hypertension, countries ought to scale up effective treatment of hypertension, because there are hundreds and hundreds of thousands of people with hypertension. They know they have high blood pressure, but not on regular treatment. And again, we know what to do. The best way to get the people with hypertension on regular, effective treatment is to use what we call multidisciplinary teams, outpatient through primary healthcare, going out to the patients, talking to them, addressing the social determinants of health, and patient support. Hypertension is also linked with obesity. In our region, 1 out of 4 children in primary school are living with overweight and obesity. I am telling, sitting, like we are doing now, that's why I'm standing, sitting is the new smoking. I think, Dr. Sharanov, we need also in WHO more meetings standing. Sitting is the new smoking. So last week in Israel, I was very proud, the First Lady of Croatia announced a new network of First Ladies and First Gentlemen, and we have the first summit of WHO European First Ladies and First Gentlemen in April in Croatia next year. Of course, hypertension, we know, has also links with alcohol. I'm a little bit ashamed to tell that in the European region, in my region, we are the heaviest drinkers in the world. 1 out of 3 of our young people who die has a link with alcohol. How much domestic violence due to alcohol, road traffic, injury and accidents. We have to do a better job to explain to our women that from the first drop they are drinking, breast cancer risk increases. We have no evidence that there is no safe level of drinking. We shouldn't say there is harmful use and there is non-harmful use. There is no safe level of drinking. It's a little bit not so nice to hear this, but honestly, it's the truth. That's why I'm very proud that last week, right, Dr. Sharanov, we approved the first WHO European Action Plan to address alcohol use. It was very difficult, very difficult. Until the last moment, alcohol industry was lobbying with cabinet of President Macron in France and other countries. But we got it through. Step by step to implement. We don't have to shock, but step by step. Third main preventable risk factor of heart attacks and stroke. I was telling about tobacco, I was telling about hypertension. The third one is air pollution. In our region, 550,000 people die every year due to air pollution. I'm very proud that our WHO European Center of Excellence in Bonn in Germany produced WHO global guidelines on good air quality. This is very, very important. Urban planning is also very important. I'm living in Copenhagen in Denmark. In Denmark is a very good example of urban planning. They have very safe places for biking. Every day in Copenhagen, Dr. Sharav knows, you too, you're also, Dr. Sharav is a very famous biker also, right? I see a fantastic picture on the Facebook. So I am biking, not using my driver. Ministers in Copenhagen, Crown Princess, biking is very safe. So we need more healthy cities. Then on SDGs, my friends, we are not doing so well on HIV/AIDS. Together with the Eastern Mediterranean region, our region is the only one still having HIV on the rise. We just had fantastic tuberculosis control conference, 90 years of your TB, Služba, I'm very proud. And we were talking with the minister this morning at breakfast, and Professor Malik, TB you cannot see separate from HIV. TB, HIV, co-infection is a big issue. We have to do a better job on HIV prevention and control. Why we have so many people who know they have HIV, but they're not on treatment? From those who are on treatment, the viral load is not decreasing enough as it should be. So we have to be critical in looking what's happening over there. And again, the key issue here is to reach out to target populations and not to discriminate them. This is on the trajectory to SDGs. The vision for health and well-being in our region is called the European Programme of Work, and it has a number of flagships. 2 flagships, I will say something. One is mental health. Mental health 19. So we launched a pan-European mental health coalition with all partners to tackle a number of issues, including to make policies for young people to find their way in this complicated mental health service. It's very difficult. We have to make it easy. In many countries, the waiting times for children and adolescents with mental health is far too long. But also for the elderly people, we have an aging population. We need to create dementia-friendly environments. And very important, we have to work on our own mental health. Tomorrow, and I'm very proud of your minister, Dr. Azar Ginyat, asked to Dr. Melita Jakob, who is with us, the famous head of the famous GDO in primary healthcare, is organizing for us tomorrow afternoon. Let's Talk Primary Healthcare show. It will be broadcast, I think, on television and globally with all the ministers of the CIS. Because I'm flying to Turkestan tonight with minister. There is the meeting of the CIS Council for Healthcare Cooperation, and we're going to talk with all the ministers of SNG how to protect our health workforce and their mental health and protect from burnout, which is a big issue. We should not be ashamed of burnout. Burnout is nothing to point the finger. We did a lot of research on mental health. And you know what was the thing that touched me most? It was that the research showed every one of us is vulnerable for mental health dip. You may think that today you are the strongest person in the world. Tomorrow you may hit against the wall because the brain is very strange. It's very strange. So we have to put a lot of mental health. And then the second flagship I want to say is Immunization 2030. Can you imagine that in 2020 and 2021, 1.2 million children in our region missed their first dose of measles, which means they're no longer protected. We saw a drop in routine immunization. Now I come to the last part of my short speech. Look into the future. We have 3 priorities that the ministers endorsed in Tel Aviv, looking towards the future, so that our health systems can manage crisis together with routine disease prevention and control, the dual track. Number 1, stronger primary health. That's why I'm so proud that thanks to the support of the Kazakhstan government, we have this incredible office on primary healthcare in Almaty, which now has global outreach. We need to bring the service closer to the homes of the people. And for this, we need to engage, to have multidisciplinary teams, not standalone mono-provider. Number 2, we need multi-modus operandi. Based on the experience of COVID-19, we need cleverly to combine face-to-face consultation with digital consultation and complement with mobile teams going into the homes of the people. And third trend in primary healthcare, we need to take advantage of digital revolution. And you have a lot of experience, my friends. Yesterday at the Astana Medical University, we launched a new project funded by European Union on digitalization of health information management. I will always remember one very striking story that I tell. It was when, with you, Melita, with the team, we went to ISIC, where we opened the first primary healthcare demonstration platform. There was one doctor, your colleague, who came, and we all had masks, but I could see that her eyes were shining. And she told, Dr. Hans, I have to tell you a story. Before we had multidisciplinary teams in ISIC, I had one child always coming back with respiratory infection and pneumonia. And the only thing I could do was to diagnose and to prescribe antibiotics, nothing else. But since we have multidisciplinary teams with psychologists, with social workers, we can address the social terms of health, because the doctor knew that the family was vulnerable and financially poor, but the doctor couldn't do anything. But with the team of social workers, they have a very good idea of the non-governmental organizations in the community who are providing social support, some financial support. They help the father getting unemployment benefit. They help the mother getting a job in daycare, and strengthened the environment in which the child became sick. And she told, now I really feel as a medical doctor that my job became so meaningful. First priority, strengthen primary healthcare. Second priority, invest in the health workforce. My friends, we are losing the health workforce. Absenteeism since COVID-19 increased with 66%. We have a big issue of burnout in the health workforce, because they have been working so hard for the last 2 years. I admire all doctors, all nurses, all health and care workers in Kazakhstan for having been doing an awesome job. Professor Marat, I think we should give an applause for all our healthcare workers. Bravo. We are going to have a major regional conference in Bucharest in March next year to chart the way forward. We published last week in Tel Aviv the first pan-European report on the status of health workers in the region, with data from 53 countries, including Kazakhstan, and 10 action points. I'm looking to Milita and Baktigul to disseminate the report in the Russian language to every one of you. It's online. And the third priority, my friends, so one is primary healthcare, second, invest in the health workforce, because let's not forget that 48% of our doctors in the region are women, 89% of our nurses are women, 98% of our midwives in the region are women. So everything we do on health workforce, we are advancing the gender equality agenda. Third priority, strengthening science and evidence. Everything we do should be underpinned by scientific rigor, and that's why university, and your university, Professor Af, is so important. And we need to protect our scientists. There are so many scientists. I mean, we were in Israel, and Dr. Sharaf will remember, the head of the National Public Health Institute in Israel has 24/7 police protection. Can you imagine? Our scientists have to fear for their lives and the lives of their family because they're attacked by anti-vaxxers because of fake news. I called upon the political leaders everywhere to protect our scientists. But we also need to do our job and increase trust of the population in science. And how do we increase trust? By being very transparent to the people, by empathize and tell them very concrete things that they could do. This is very important. Dear colleagues, I will finish because I understand there may be some difficult questions. But when I became regional director 2.5 years ago, I knew that every crisis passes. But I underestimated how fast peaceful time is also passing. And there your country has such an important role. What is the name again, Dr. Chananov, of the beautiful instrument I got? Dombra. Yesterday I got very beautiful Dombra. And I understand that when the Pope was here recently, that he compared your country, Kazakhstan, with the Dombra. You have two threads. Basically, you have the West and you have the East. And like the Dombra is pulling them together, your country, your president, your healthcare workers is bringing East and West together. We need peace to improve health. But we also have a big job because health is also bringing peace. My principle is здоровье это не политически. We need to work for health of all people in all countries. And I would like to finish with a citat from your famous poet and philosopher Abaya. Будь разумен, укрепляй свой дух в борьбе, лишь бездарнее покарается судьбе. Рахмет.
Спасибо большое, доктор Ханс, за ваше выступление, за то, что вы в целом определили четкие вектора направления проблемных вопросов, в частности, геополитическая ситуация, связанная с ситуацией в соседних странах, ситуацией, связанной с пандемией и новыми вызовами, которые стоят перед нами сегодня. Это Monkey Pox и другое. Вы четко определили пути совершенствования здоровья населения. И действительно при поддержке специалистов Всемирной организации здравоохранения, вашей команды, в Казахстане проводится большая работа по увеличению налога на табачную продукцию, что у нас прописано в нашем национальном проекте «Здоровая нация». И при поддержке руководства страны я уверен, что эти мероприятия будут нами полностью реализованы. Вы очень хорошо сказали о важности соблюдения здорового образа жизни и в механизмах превенции кардиоваскулярных заболеваний, таких как здоровый образ жизни. Помимо всего, это, конечно, снижение употребления соли, снижение хронических неинфекционных заболеваний. And Dr. Hans, once again, you just showed us the general principles and the mission of the health, and by saying that здоровье это не политическая вещь. So the health is not should stand along from the policy, and when people wants to mix up the healthcare issues with the political issues, And we are, as the health workers, have to stand together and show our solidarity in everything. So some kind of wars can happen around the globe, but again, the health of the people is the most important things. And thank you very much, Dr. Hans, for your job and for your commitment in order to providing equitable health to all, leaving no one behind. So thank you very much on behalf of our staff. So also you updated us with the new regional action plans, which has been discussed during the regional committee on reducing alcohol consumption and pushing for accelerated action to tackle tuberculosis, which was just announced during the conference today in the early morning, HIV, viral hepatitis, and sexually transmitted diseases. So, Dr. Hans, now I would like to give the floor to our students, and if they have any questions, so we will open the discussion. And due to the shortness of the time, as your schedule is very hectic, we know, so every minute is in count. So let's have like up to 5 questions from the auditorium, and then we'll thank and we will keep doing our rest of the program. So, уважаемые друзья, коллеги, давайте 5 вопросов от аудитории доктору, уважаемому профессору Хансу. Он постарается на них ответить, после мы должны следовать нашей программе. Спасибо.
Dear Mr. Kluge, thank you so much for your effort and thank you so much for the whole... Я могу продолжать? Okay, thank you. Again, thank you so much for your effort and thank you so much for the speech that you gave us. As students, we really appreciate and we are really pleased to hear those words, and you showed again how the simple things can affect to the health, and again how the health can affect to other, not the simple but really important things in our life, such as the policy, the mental health and everything. And we really appreciate it, and we are really pleased to hear this at the Future Doctors. My name is Kadyrova Ainur. I'm the student of the 6th course. I'm the intern in the International Medical Faculty in this university, and I would like to ask you the questions about the meeting that was held on from the 11th to 14th of September. I would like to ask what kind of recommendations were adopted and what kind of influences it will have. Thank you so much.
Спасибо большое, Айнур, за вопрос. Предлагаю задать все вопросы, а потом доктор Ханс попытается ответить на них всех сразу. Пожалуйста, какие еще будут вопросы?
Good afternoon. Thank you so much, Dr. Hans, for your presentation, for your time. My name is Amirkul Vaislu. I'm intern of International Medical School. So we know that we have a lot of recommendations from WHO on healthy lifestyle, and I want to ask, how do you follow these recommendations by yourself?
Спасибо большое, очень интересный вопрос. Пожалуйста, еще. Вот молодой человек руку поднимает. Да. Микрофон дайте, пожалуйста. Можно голосом, мы вас услышим. Да, профессор, пожалуйста. Да.
For your wonderful and nice informative presentation. I am very happy to hear your presentation and your effort in preventing the diseases all over the world. Second, I would like to congratulate you for getting the Honorable Professor of Kazakhstan National Medical University. That is a great honor to you. My name is Samir Ross. I am a visiting professor from United States of America to Kazakh National Asfandyarov Kazakh National Medical University. My title is I am a research professor at the National Center for Natural Products. I am full professor of pharmacology at School of Pharmacy. I am honorable professor at Asfandyarov Kazakh National Medical University. I I would like to thank the university for inviting me here and for our collaboration for together for almost 1 decade. And as a result of that, I had at least 16 PhD students in this country. And I am so happy to meet all of them this time. My question is very simple. In early September, you had visited the United States of America. Please, can you tell us the most important moments of this visit? Very simple. Thank you.
Thank you very much, Honorable Professor, for your question. So we have 2 more questions from the auditorium. So please. Молодой человек, он был раньше, извините, да.
Good morning. My name is Rahmbek Razakbergenov. I'm also the intern doctor here at Kazakh National Medical University. We all know that this is not your first visit to Kazakhstan, and especially to our university. And my question is, are you considering working here in Kazakhstan and in our university after completing your career in World Health Organization?
Thank you. That's a very, very interesting question. Yeah. Пожалуйста, вот.
Hi, my name is Adele, and I'm medical student as well, 6-year intern, and I'm also regional assistant in IFMSA, International Federation of Medical Students Association. And I have a question about SDGs. Like, which one of the SDGs is like more important and like the one you want to work on in our country? Yeah, I just want to know like one of the 17s, which one is more important and you want to improve. Thank you.
Спасибо. Thank you. Да, мы собрали 5 вопросов, какие планировали. Давайте дадим слово доктору Хансу Kluge осветить их.
Thank you everyone for the awesome questions, really. Very difficult to answer in a short time, but I will give it a go. First question I think was from Ainur on the regional committee last week. So there were a number of important European health policies approved. The first one was the first ever European action plan on digital health. Because I say before COVID-19, digital was optional. But since the COVID-19, digital is not optional anymore. The future is digital. Of course, there are many very large and bigger organizations than WHO working on digital health. But we see ourselves as the guardian to ensure and to watch that the application of digital tools does decrease inequities in health and not increase inequities, so that the digital health is not about another fancy app or tool, but is really helping to leave no one behind, to reach the people in the rural areas, for example. Also not to exclude elderly people who may not know how to make a digital appointment with a medical doctor. So that was a very important plan, particularly on what we call the governance of digital health, and that's our main aim. Second one, we had the first ever European action plan on behavioral and cultural insights. The idea is that people often know what is the healthy choice, but still they don't take the healthy choice. So we have created this behavioral and cultural insights, and actually we applied it already during the COVID in 32 countries to find out who are the people who do not want to be vaccinated. And actually only very small part are people who refuse. The majority has some misinformation or misconception. So these were 2 very important plans. Also, we renewed the regional action plan to stop tuberculosis, HIV/AIDS, sexually transmitted infection and hepatitis. And congratulations Kazakhstan, because the start date of this plan is the 1st of January next year, but this morning already we started, and Kazakhstan showing Central Asia, I think we had China, Mongolia, a lot of countries showing the way forward. There are quite a number of other plans, but for the sake of time, right, I would like to invite everyone to have a look at our website. And then, yes, I mentioned during my speech the European Action Plan to push back alcohol abuse. Question number 2 on healthy lifestyle. Actually, last week at the Regional Committee, we started in Tel Aviv, it was a fantastic weather. We started at 6:30 in the morning with Walk the Talk. So we invited all the ministers, the leaders, to do some physical exercise. You know, some were doing the running, like me, other one yoga on the beach. Yesterday, Professor Sharana was telling, yesterday morning, I was with director of Astana Medical University and 1,000 first-year students and some Olympic champions in boxing and weightlifters from Kazakhstan doing also the running. So wherever I go, I try to give the example. I am the region director who excluded alcohol at lunch in WHO. We used to have alcohol drinks before I arrived when we invite the minister at lunch. Now we give what I call mocktail, region director mocktail. You know, you can have, so the idea is we should be able to celebrate without alcohol. And as I was mentioning, I'm also biking to the work. So we have to give the example. The one element where I'm doing unhealthy, and if you have any advice, please tell me, I need a little bit more sleep. But this is a challenge for many of us. Thank you so much, Honorable Professor, for coming first and foremost from the United States and to assist the country. This is very important. Thank you. This is a great commitment from your side. So the big achievement when I went in August to Washington, D.C. again, is we agreed on a tripartite transatlantic partnership between my colleague, the region director of PAHO, Carissa Etienne, the Pan-American Health Organization, 1. 2, the United States Department of Health and Human Services, and 3, the WHO European region. And a lot has to do with, we're going to work together on health workforce, because health workforce is migrating in the whole world. This is a global issue, number 1. Number 2, on what I call preparedness 2.0. What is the new generation to be prepared for emergencies? Because both the United States and our region were the 2 epicenters of the pandemic. And same for the monkeypox. And the third one is a new collaboration, transatlantic, where I'm very proud of. It's starting, is around the Arctic Circle. Because both the Americas and Europe have borders with the Arctic. And there are many indigenous populations. Actually, in January, I will go for the first time to Greenland to leave no one behind. Number 4, do I consider to work after my career in Kazakhstan? If I get this prestige, Professor Ranov, I would love it. Kazakhstan is very close to my heart, very close. I will never forget that Kazakhstan, when I was director, not region director, but director of health system, gave me this big padarak, this big gift of having a global center on primary healthcare. Professor Shoranov and me, I remember at the World Health Assembly, we were working through the night to make the agreement, Memorandum of Understanding, the agreement. Because, you know, it's about legal issues and we are so committed. And here, I have to say emotionally that I always admire and have memory of the minister at that time, Dr. Saldat Karibekova, God have her soul, who unfortunately passed away, who was the minister. And she was telling, Dr. Hans, there is no way I can go back to my country without agreement signed. And we were working through the night. So this is only a small thing I can do back to the country. SDGs, great question. Obviously, our SDG is SDG 3, health and well-being, but we need to put our SDG 3 in all SDGs. And if I have to pick one, I would say environment. Because the lesson we learned from COVID-19 is that the future threats will be zoonotic again, transmitted from animals to humans. So we need collaboration between the human health, the animal health, and the environment. And we call it Jedine Zdarovia, one health. That is our next frontier. Finally, I would like to say to the young people, I am very committed to work with young people I created for the first time WHO European Young Professional and Young People Forum. We will have the first summit in Tirana in October, and please ask Baktigul or Milita information if you would like to participate. Rahmat.
Thank you very much, Honorable Professor Dr. Hans. You are not just a regional director. I would say, as the minister, Madam Minister said in the morning, you are Minister of the Ministers for the 53 countries. And it was a great honor for us to learn and personally from you, this very, very remarkable and important things which will help us to better understand the global health, better understand the current situation and the current normality, and to prepare better our students for their future work. Thank you very much once again. Давайте поблагодарим доктора Клюге. Доктор Клюге, если не возражаете, я предлагаю сделать 3 фото напротив каждой из трибун на память с нашими участниками сегодняшней лекции. Спасибо.
1, 2, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30, 31, 32, 34, 35, 36, 37.
Раз, два, три. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. 1, 2, 3.